I never knew that Nigerian healthcare infrastructure was in such bad states, Boss Mustapha declared. The secretary to the government of the Federation, Boss Mustapha, has decreed the poor state of Nigerian healthcare infrastructure. Mr. Mustapha, who is also the chairman of the Presidential Task Force on Coronavirus, said that he realized how bad it was after he was appointed to head the team. He made this known during a meeting with the leadership of the National Assembly on Thursday. I can't tell you for sure. I never knew that our entire healthcare infrastructure was in the state in which it is until I was appointed to do this work, he said, while he noted that the epidemic has provided the opportunity to examine the state of the national healthcare systems, which is in dire need of reforms and funding. He said that the weakness in Nigerian health system became more daring given the way more established health systems in Europe and America collapsed under pressure. He, however, assured that there are plans to lay a legacy foundation for the immediate, medium, and long-term development of the health system in the wake of the coronavirus pandemic across the country. To this end, he said that the task force has proposed to utilize the resources being mobilized in a strategic manner. This includes direct development and delivery of critical infrastructure to states by donors, direct procurement and delivery of personal protective equipment and other critical equipment by donors, development of rapid response teams to states for capacity building and reports, and expansion of the testing capacity in the country. Mr. Mustapha added that for transparency and accountability, the task force will not be directly involved in the collection and disbursement of the cash donations for COVID-19. The Accountant General of the Federation has already established the account details for collection through some commercial banks and also provided the modalities for its utilization. All the main COVID-19 accounts that be domiciled in the Central Bank of Nigeria. However, all non-cash donations should be daily received by the PTF, acknowledged, documented, and appropriately deployed, he said. Mr. Mustapha further explained that Nigeria, like the rest of the world, is at war against a dangerous enemy, and all ends must be on deck to successfully prosecute the war. This to the end, he charged the National Assembly. Mr. Mustapha further explained that Nigeria, like the rest of the world, is at war against a dangerous enemy, and all ends must be on deck to successfully prosecute the war. To this end, he charged the National Assembly by develop a legislative framework to prepare Nigeria for any further pandemic, develop a legislative framework for reforming and transforming Nigerians' healthcare systems, strengthen the legislative framework for economic growth through domestic infrastructuring, deepen the legislative oversight during this pandemic and beyond, pass legislations that will further ease the ability of the executive to cushion the impact of the economic decline, and be part of the community mobilization and enlightenment efforts. While applauding the task force for the work done so far, the Senate President Ahmed Lawan advised the team to have a better coordination of the donations received from public-spirited individuals, corporate bodies, and institutions to avoid duplications or the relevant bodies working at crop purposes. First of all you're supposed to be the custodian of all the challenges that we face as far as COVID-19 is concerned. If any state has a challenge, I am sure there is a proper structure and route for reporting so that you take down the situation and take the necessary steps. I believe that we face one critical challenge today in our fight against COVID-19. We have donations made by various organizations, corporate bodies, and so on and so forth. But it is my candid opinion that there is no coordination. The corporate Nigeria, as I was told, as at yesterday, has gathered 22 billion naira. The Nigerian National Petroleum Corporation, I was told, had $28 million. CBN and the banks, I don't know how much they have. The National Assembly, the ministers, and so many individuals and institutions have also made donations, he said. He also suggested that donations should go just one common platform as against multiple accounts. I believe that we must have a central body and not the PTF. None the cooperative groups should receive and manage the funds, but based on what the Constitution provides for, where everybody is just collecting and spending. I think it will lead us in a very bad shape. When people contribute their funds, they want to use such funds properly and utilize it very well. They want to see efficiency. They want to see transparency. They want to see accountability and, of course, probity in what the funds are used for. There could be duplication working across purposes. At the end of the day, there will certainly be inefficiency in the application of such resources. But this meeting is going to give us opportunity to discuss this and the way forward. The meeting, he said, is aimed at ensuring that performance is involved and service delivery is effective and efficient. President Muhammadu Buhari had approved the distribution of stimulus package to the most vulnerable during the lockdown. He had also ordered that impounded rice be distributed across the 36 states to cushion the effects of pandemic. The Ministry of Humanitarian Affairs has since announced the distribution of the first tranche of 5 billion naira. The number of confirmed cases in the country has been on the increase. As of 9:30 p.m. on Thursday, the NCDC announced a total of 288 cases, including 7 deaths. Wow. Viewers, thank you for listening to this news. With what you've heard concerning what Mr. MUSTAPHA, Boss MUSTAPHA, has said concerning the healthcare infrastructure that he met in a bad state, that he never knew that this Nigerian healthcare infrastructure was in such a bad state that nobody could even do anything about, not until he was given a position as the head of as among the team of the health system, that he wouldn't have known if the healthcare, Nigerian healthcare has been in this shape. He said that he wants, now that he is now among, he has been given a position now that he's among the healthcare ministers, then he is saying that for transparency and accountability, the task force will not be directly involved in the collection and disbursement of the cash donations. He said now that he has been the head or leader of this system, that the accountant general of the federation has already published this account details for collection through some commercial banks, and also provide the modality for its utilization. That all this money that is being collected by different banks and different organizations should be kept in one account, not in a separate account. Should not be disbursed separately. That it must be a part of community mobilization and enlightenment efforts. That the tax for National Assembly, he said that Nigerians, like the rest of the world, is at war against a dangerous enemy, and all hands must be on decks to successfully prosecute the war. That's what he said. He also charged the National Assembly to develop a legislative framework to prepare Nigeria for any future pandemic. He said that they should always strengthen the legislative framework for economic growth through domestic manufacturing. He also said that we should be part of the community mobilization and enlightenment efforts. That the task force we should thank and appreciate the task force for the work done so far. That we should be appreciative, and also should deepen the legislative oversight during this pandemic and beyond. We should be careful. We Nigerians should support these people, since he has known that the system, he has known that the healthcare infrastructure, Nigerian healthcare infrastructure, is now in this shape. That he never knew it was in this bad. It was this bad. But now that he has realized this, then he's telling Nigerians to please do that which he has said. He made this known during a meeting with the leadership of the National Assembly. When they were conducting this meeting, he told him, I never knew that this system, Nigerian healthcare infrastructure, is this bad, is in this bad shape. That he never knew that the entire healthcare infrastructure was in a state in which it is now, until he was appointed to do the work. So, viewers, that is all I have to say. I don't have much to say.